Every day, we bring you examples of the grim reality of this latest COVID surge. That includes conversations with patients and loved ones, doctors and nurses. And today, we speak with emergency workers who see patients before they get to the hospital. Almost all of the COVID patients who need their help have not received a vaccine. Our lead national correspondent, David Begnaud, rode along with a crew in Louisiana to find out what they're up against.
How long have you been waiting?
I have been waiting for 3 days.
3 days?
Yes.
You've been here for 3 days?
For 3 days.
Huh?
Yes, 3 days.
Oh my God, wow. What's your name, ma'am?
Julia.
We were right there when 48-year-old Julia Clay was loaded into the back of an Acadian ambulance and transported to Our Lady of Lourdes Regional Medical Center in Lafayette, Louisiana. 59% of the beds here are filled with COVID patients, and 93% of them are unvaccinated. And now Clay is one of them.
Waiting, and I'm taking the vaccine.
You wish you would have taken the vaccine?
Yes.
Acadian Ambulance, which is based in Louisiana, is the largest privately owned ambulance company in the country. We spent 3 days with them. Dr. Chuck Burnell is their chief medical officer.
Of your call volume, how much is dominated by COVID patients?
Around 30 to 40% of our call volume involves COVID patients.
211, I'm en route.
27-year-old Trent Tarbutton is a field supervisor for Acadian.
I think we have 3 of them right now currently waiting.
He took us to Lafayette General, where ambulances were backed up because there were no ER beds available. Recently, medics have had to wait here with patients anywhere from 30 minutes to 3 hours.
We kind of just have to tell the hospital, like, look, find something. We don't care where you put this patient. You have to put them somewhere because we need to run emergencies.
Tarbutton's supervisor is Keisha Trahan.
We're all drowning. We're all drowning and sucking air through a straw.
But people will say it's not as bad as you're saying it is.
I would tell them they might want to come work in EMS. Come in the ER. Come, because the nurses feel it. We feel it.
This COVID surge has also forced Acadian to transfer some patients out of state.
This is Allison.
Louisiana has a call center in Baton Rouge that is focused on finding available beds and advanced care for patients around the state.
All right, so y'all can't accept?
We were there when trauma care coordinators David McCarroll and Allison Lafitte tried finding a bed for an elderly man in central Louisiana who had gone into cardiac arrest.
Hey, it's Allison at Learn Again.
There were 15 hospitals within 100 miles, but they told us they could not find a single available bed.
They have no beds, no staff to take care of it. That's where we're at today. And that's where we've been.
Okay, so y'all not gonna transfer?
After 2 hours looking, Lafitte says the doctor told them the patient's condition had worsened and he could no longer be transferred.
He has since gone back into cardiac arrest a couple of times. It's been a roller coaster ride for the family.
Again, Dr. Chuck Burnell.
A lot of patients that we deem would not probably benefit from the hospital are already being treated in place at home and being left at home.
They have not refused to transport anyone yet.
We're days away from that happening right now, less than a week.
It's the unthinkable, but he's got to juggle other priorities too, like speaking almost daily with medics who are not vaccinated. 2 of those unvaccinated employees you met at the start of our story. They are the 2 medics who transported Julia Clay, the COVID-positive patient, to the hospital.
Transporting it, you're up close with it. Does that not change your opinion?
No. I'm me and my family are very religious. We pray a lot. We've always been the type of people that we trust God.
Are you vaccinated?
No. No. Should I be? Yes. Yes, I should be vaccinated. That is very careless of me, because I do come in contact with other people. Will I be vaccinated soon? Yes.
You have more exposure than most anybody else.
Yes.
And you still hadn't gotten it.
I haven't. Oh. And do I push it? Yes, I do. I push it. Yes, get you vaccinated.
You mean push it in terms of, telling other people to do it?
Yes, I do.
But you haven't done it.
I'm a hypocrite.
If they were offering it right now, would you take it?
Yes.
We should.
And that's why it's confusing, guys, to people when they see medical workers that say, I'm not going to get it either.
Well, we have an update on that.
Yeah.
What is it?
Keontae Williams, the woman we saw at the very end there, she has subsequently been vaccinated.
Nice.
You'll see her there.
Nice.
So that's good news all around. But my jaw just drops when I hear
it boggles your mind.
the nurse in the back of the ambulance say, I won't do it.
But did you also hear Keontae Williams say, yes, I'm a hypocrite. I'm a hypocrite. I'm telling people to get it. I always say,
she
please
sounded
just
like
listen
she was
to the doctor.
she wanted to get it. She sounds like she was very busy. Her colleague, however, though, had different ideas about it.
Well, what's most alarming?
Tony, I don't even know how you could be too busy during this time. This Delta variant is no joke.
Well, and I don't know how many
than anything else.
How many stories like this do you have to see? But the scary part isn't just that you will get sick.
Yes.
But now they're not even able to find beds for people in hospitals in some areas because they're so full.
And if 30 to 40% of the calls for the ambulance are now COVID related, what about all the other calls that are happening anyway?
Yeah.
I worry about them.
Right.